Welcome back to Learn with Professor Janula. If you're a nursing student, this channel is just for you. Don't forget to subscribe and hit the bell icon. Today we're learning about changes in reproductive system during pregnancy. So go ahead, subscribe, and let's get started. Pregnancy brings many amazing changes to a woman's body. The reproductive system undergoes important anatomical, physiological, and hormonal changes to support the growing baby. These changes help in the growth and development of the fetus and also prepare the mother for childbirth and breastfeeding. Hormones like estrogen and progesterone play a major role during this period. They help the reproductive organs adapt and function properly throughout pregnancy. In simple words, the body changes naturally to create a safe and healthy environment for the baby. So, these changes are completely normal and very important for a healthy pregnancy. Let's now understand how the uterus increases in size during pregnancy. In a non-pregnant woman, the uterus is quite small and weighs only about 50 to 70 grams. But as pregnancy progresses, the uterus grows continuously to support the developing baby. By the end of pregnancy, or at full term, the uterus weighs nearly 1,000 grams. That's a huge increase in size and weight. The capacity of the uterus also changes dramatically. Normally, it can hold only around 10 milliliters, but during pregnancy, it expands to hold about 5 liters or even more. This extra space is needed for the baby, placenta, and amniotic fluid. The length of the uterus also increases from about 7.5 centimeters to nearly 35 centimeters. Another interesting change happens in the uterine wall. In early pregnancy, the wall becomes thicker, increasing from around 1 centimeter to about 2 centimeters. But toward the end of pregnancy, the wall becomes thinner, around 0.5 centimeters thick, because the uterus stretches as the baby grows bigger. All these changes help create a safe and comfortable environment for the growing fetus throughout pregnancy. Now, let's talk about the growth of the uterus during pregnancy. As the baby grows, the uterus also grows upward inside the abdomen, and its position changes at different weeks of pregnancy. By the end of the 12th week, the uterus can be felt just above the symphysis pubis, which is the pelvic bone area. Around the 20th to 22nd week, the uterus reaches the level of the umbilicus, or the belly button. By the 36th week, the uterus grows so much that it reaches the xiphoid process, which is the lower end of the breastbone. At this stage, the enlarged uterus can press against the diaphragm and may cause difficulty in breathing for some mothers. So, the gradual upward growth of the uterus is an important sign of normal fetal development during pregnancy. Now let's look at an important event that happens near the end of pregnancy, called lightening. About 2 weeks before delivery, usually around the 38th week in a first-time mother, or prima gravida, the baby's head starts moving down into the pelvis. As the baby settles lower, the uterus also drops slightly and returns to almost the same height it was at around 36 weeks. This downward movement of the baby is called lightening. After lightening, the mother may feel more comfortable while breathing because pressure on the diaphragm decreases. However, she may feel increased pressure in the pelvic area and may need to urinate more frequently. So, lightening is a normal sign that the body is preparing for labor and delivery. Here, we can clearly see the process called lightening. In the first image, the baby is positioned higher inside the uterus. But in the second image, the baby's head has moved downward into the pelvis. This usually happens near the end of pregnancy, especially around the 38th week in first-time mothers. As the baby moves down, pressure on the mother's diaphragm decreases, so breathing becomes easier. That is why this process is called lightening. However, because the baby is now lower in the pelvis, the mother may feel more pelvic pressure and may need to pass urine more frequently. So lightening is a normal and important sign that the body is getting ready for labor. Now, let's discuss the changes that occur in the body of the uterus, especially in the uterine muscles during pregnancy. The first important change is hypertrophy and hyperplasia. Hypertrophy means the muscle fibers increase in size, while hyperplasia means there is an increase in the number of muscle cells. So during pregnancy, the uterine muscle fibers become longer, broader, and stronger to support the growing fetus. Another important change is stretching. After about 20 weeks of pregnancy, the uterus stretches even more because of the growing baby inside. The muscle fibers elongate further as the fetus increases in size. These muscular changes help the uterus expand enough to accommodate the baby, and also prepare the uterus for effective contractions during labor. Next, the blood flow to the uterus increases significantly. This happens because hormones like estradiol and progesterone cause vasodilation, which means the blood vessels widen. Increased blood supply helps provide oxygen and nutrients to the growing baby. Next, the fundus, which is the upper part of the uterus, enlarges more rapidly than the body of the uterus. The shape of the uterus also changes throughout pregnancy. In the early months, the uterus maintains its normal pear-shaped or pyriform shape. By around 12 weeks, it becomes more globular or rounded. Around 28 weeks, the uterus takes on an ovoid shape, which means egg-shaped. And after 36 weeks, it appears more spherical due to the full growth of the fetus. These structural changes help the uterus adapt and provide enough space and support for the developing baby throughout pregnancy. Now, let's discuss some positional and functional changes of the uterus during pregnancy. Normally, the uterus remains in its anteverted position, which means it tilts slightly forward, up to about 8 weeks of pregnancy. As the uterus enlarges, it starts pressing on the urinary bladder. Because of this pressure, many pregnant women experience frequency of micturition, or frequent urination, especially during early pregnancy. Another important feature during pregnancy is Braxton Hicks contractions. These are irregular, infrequent, and painless contractions of the uterus. They may feel like mild tightening of the abdomen, but they do not cause dilatation of the cervix. So, Braxton Hicks contractions are often called practice contractions, because they help prepare the uterus for true labor later on. Here, this image shows the normal position of the uterus, called the anteverted uterus. An anteverted uterus means the uterus tilts slightly forward over the urinary bladder. This is considered the normal position in most women. As you can see in the diagram, the uterus is located above the bladder and in front of the rectum. During early pregnancy, the uterus usually remains in this forward-tilted position up to about 8 weeks. This position is important because, as the uterus enlarges during pregnancy, it can press on the bladder and cause frequent urination in pregnant women. So, an anteverted uterus is simply the normal forward-leaning position of the uterus inside the pelvis. Now let's discuss the changes that occur in the isthmus of the uterus during pregnancy. The isthmus is the narrow portion between the body of the uterus and the cervix. During the first trimester, this area undergoes hypertrophy, meaning it increases in size, and it also elongates to nearly 3 times its original length. At the same time, it becomes much softer and more flexible. As pregnancy progresses beyond 12 weeks, the circularly arranged muscle fibers in this region help retain the fetus safely within the uterus. These changes are very important because they allow the uterus to expand properly while still supporting and protecting the growing baby throughout pregnancy. Now let's discuss the changes that occur in the cervix during pregnancy. The first important change is softening of the cervix, which is called Goodell's sign. This happens because the blood supply to the cervix increases during pregnancy. Due to this increased vascularity, the cervix becomes softer and more elastic. Another important change is bluish discoloration, known as Chadwick's sign. Because of increased blood flow and congestion in the pelvic area, the cervix and surrounding vaginal tissues develop a bluish or purplish color. These are early signs of pregnancy and occur due to the hormonal and vascular changes taking place in the reproductive system. Now, let's continue with more changes that occur in the cervix during pregnancy. The next important change is the formation of the mucus plug. During pregnancy, thick cervical mucus collects and seals the cervical canal. This forms a protective barrier called the mucus plug. The main function of this mucus plug is to protect the fetus from infection by preventing microorganisms from entering the uterus. Another change is increased glandular activity. The cervical glands enlarge and become more active during pregnancy. As a result, They produce and secrete more mucus than usual. These changes help maintain a safe and protective environment for the growing baby throughout pregnancy. Now let's discuss the changes that occur in the vagina during pregnancy. The first change is increased vascularity, which means increased blood supply to the vaginal tissues. Because of this increased blood flow, the vaginal mucosa develops a bluish-purple discoloration. This change is known as Chadwick's sign. Another important change is increased elasticity. During pregnancy, the vaginal tissues become softer, more flexible, and stretchable. These changes help prepare the birth canal for labor and the passage of the baby during delivery. So the vagina undergoes important structural changes to support childbirth safely and effectively. Another important change is increased secretions. During pregnancy, many women experience a thick white vaginal discharge called leukorrhea. This occurs because of increased blood supply and hormonal changes. The vaginal environment also becomes more acidic. This acidic pH helps protect against infections by preventing the growth of harmful microorganisms. Another change is thickening of the vaginal mucosa. Due to hormonal stimulation, especially from estrogen, the vaginal lining becomes thicker and more resistant. This helps prepare the vagina for labor and delivery. So these changes help maintain protection, flexibility, and a healthy environment during pregnancy. Now let's discuss the changes that occur in the ovaries during pregnancy. The first important change is that ovulation stops during pregnancy. This means no new ova are released once pregnancy is established. Another important structure is the corpus luteum. During early pregnancy, the corpus luteum enlarges and becomes very active. Its main function is to secrete progesterone, which is essential for maintaining pregnancy and supporting the uterine lining. The corpus luteum continues this hormone production until the placenta develops enough to take over the production of progesterone. So the ovaries play an important supportive role during the early stages of pregnancy. Now let's discuss the changes that occur in the fallopian tubes during pregnancy. During pregnancy, the fallopian tubes undergo slight hypertrophy, which means they become slightly enlarged. There is also increased vascularity, or increased blood supply, due to hormonal changes. Another important change is reduced motility. The movements of the tubes decrease during pregnancy because fertilization and transport of the ovum are no longer needed. As the uterus enlarges and rises upward, the fallopian tubes are pushed upward and become positioned almost vertically along the sides of the uterus. The total length of the tubes may increase slightly, and the tubes also become more congested because of increased blood flow. These changes are normal adaptations that occur in response to pregnancy-related hormonal and structural changes. Now let's discuss the changes that occur in the external genitalia, also called the vulva, during pregnancy. One common change is increased pigmentation. Due to hormonal changes, the skin of the vulva may become darker in color during pregnancy. There is also increased vascularity and softening. Increased blood supply makes the tissues softer, fuller, and more elastic, helping prepare the birth canal for delivery. Another possible change is the development of varicosities. These are enlarged veins that can appear because of increased blood flow and pressure during pregnancy. So, these changes are normal adaptations that help the body prepare for childbirth. Now, let's discuss the changes that occur in the breasts during pregnancy. The first major change is enlargement of the breasts. This happens because the glandular tissue inside the breasts grows and develops in preparation for breastfeeding after delivery. Another important change is increased vascularity. Due to increased blood supply, the veins over the breasts become more visible and prominent during pregnancy. These changes help prepare the breasts for milk production and lactation after childbirth.
The next change is areolar changes. The areola, which is the dark area around the nipple, becomes darker during pregnancy due to increased pigmentation.
The Montgomery tubercles, which are small glands present around the areola, also enlarge and become more noticeable. Another important change is colostrum formation. After the first trimester, a yellowish fluid called colostrum may start appearing from the breasts. Colostrum is the first form of milk and is very rich in nutrients and antibodies for the newborn baby. There are also nipple changes during pregnancy. The nipples enlarge, become more prominent and more erectile in preparation for breastfeeding after delivery. All these breast changes help prepare the mother's body for successful lactation and infant feeding. Now, let's discuss the pelvic changes that occur during pregnancy. The first important change is relaxation of the pelvic ligaments. This happens mainly because of the hormone relaxin, which helps loosen and soften the ligaments of the pelvis. Another change is increased joint mobility. The sacroiliac joints and the symphysis pubis become softer and more flexible during pregnancy. This allows the pelvic bones to move slightly. Finally, there is pelvic expansion. These changes help widen the pelvis and facilitate childbirth by making it easier for the baby to pass through the birth canal during delivery. So, pelvic changes are important adaptations that prepare the mother's body for labor and childbirth. Now, let's quickly review some important clinical signs of pregnancy related to reproductive changes. The first one is Goodell's sign, which refers to the softening of the cervix due to increased blood supply. Next is Chadwick's sign. This is the bluish discoloration of the vagina and cervix caused by increased vascularity during pregnancy. Another important sign is Hegar's sign, which means softening of the lower uterine segment, especially the isthmus. And finally, Braxton Hicks contractions are irregular, painless uterine contractions that occur during pregnancy and help prepare the uterus for labor. These clinical signs are important because they help healthcare professionals identify and assess early pregnancy changes.
To conclude, pregnancy brings many important changes in the reproductive system to support the growth and development of the baby.
These changes help prepare the mother's body for childbirth and breastfeeding. For nurses and healthcare professionals, understanding these changes is very important to provide proper antenatal care, identify abnormalities early, and educate expectant mothers effectively.